In room 16, you have Terry Schiavo. She's a 26-year-old female who suffered from cardiac arrest due to hypokalemia in her home. Oxygen flow to her brain was interrupted for 5 minutes, causing irreparable damage. She requires total care, needs assistance with all ADLs, range of motions. Make sure you get her INOs. Last night her vital signs were stable, lab values were stable.
It's her potassium? Okay.
Yeah, it's up to 3.5 now.
Okay.
So that's stable too now.
Alrighty. Thank you.
Okay. Dorothy Orum's self-care theory comprises those activities performed independently by an individual to promote and maintain a person's well-being. Self-care deficit occurs when the person cannot carry out self-care and lacks other support systems, such as family, to take care for them. The nurse then meets the self-care needs by acting or doing for, guiding, teaching, supporting to promote the patient's ability. Orum's goal, in a simple statement, is overcoming human limitations. She provides 3 nursing systems that can be implemented towards different individuals. Wholly compensatory nursing system, where the patient is completely dependent. Partially compensatory, where patient can meet some needs but needs nursing assistance. And supportive educative, where patient can meet self-care requisites but needs assistance with decision-making or education. Terry Schiavo is a 26-year-old female who collapsed in her home due to a potassium deficiency. Oxygen flow to her brain is interrupted and there's permanent damage. The court rules that she's incapacitated and appoints her husband, Michael Schiavo, as her legal guardian.
Hello, Mr. Schiavo. My name is Whitney. I'm going to be Ms. Schiavo's nurse today.
Please call me Michael and call her Terry.
Will do, Michael. I'm going to do a quick assessment real fast. Is that okay?
Yes.
Awesome. Let me check for some swelling. Terry, if you can feel my hand, squeeze it.
How is everything?
She's okay. Her vitals are stable. How are you doing?
I don't know where to begin. We've been here, it's been 2 months already, and I don't know what to do. Everybody's telling me different things. Is she ever going to recover? Is she going to get better soon? We have a court hearing next month, and over there they're going to talk about power of attorney, stuff like that. But I don't really want that. My friend he's a lawyer, he told me that they're probably going to make me her legal guardian, but I'd rather her just be okay and things go back to the way they were. I don't know about these tubes and all these other things.
That's understandable. It's probably hard to see your wife like that. But until the court date, I'm going to be her nurse, and so I'm going to be doing the feeding tube, checking her IVs, vitals, and stuff like that. So if you wanted to watch it and help out sometimes so you can be more involved.
Sure.
You want to do that?
Yeah.
Okay, awesome. Let's start with the feeding tube.
In this scenario, Terry is a dependent patient. The nurse must use the wholly compensatory nursing system to provide total care for Terry. Since the patient is severely incapacitated, the family must be educated, supported, and be provided an environment that is conducive to everyone's well-being. While Michael is gone for work and for court appointments, the nurse can use Orum's theory of self-care deficit to care for Terry.
What a day. I got appointed legal guardian over Terry. I don't know how to feel about that. How is she?
Hi, Michael. She's doing good. I just turned her to prevent some bed sores. I fed her through the feeding tube, and then I also gave her a sponge bath.
That's great. For work, my work schedule, my leave of absence days are ending, so I'll be here a lot less during the day.
Oh, that's totally fine. That's what we're here for. I'll definitely take complete care of her, and if you need anything else, just let me know.
Okay.
Terry, this is a bear. Can you try to grab it, move it around a little bit? Good job.
Terry is still a dependent patient. Due to rehabilitation efforts, Terry has improved in functioning by a small fraction. Still, the nurse must use the partially compensatory nursing system to provide care for Terry. Here we see the nurse trying to orient the patient with various objects of activities of daily living. At this point, there are people wishing for Terry's speedy recovery, and issues regarding her continuation of life are starting to surface.
You never knew what she wanted. All you ever did was shove ideas down her throat.
How can I don't know? I'm her mother. I must know better than you.
You know better. You should know better that this is not the way she wanted to live.
You couldn't possibly understand how to raise a kid. I know how she feels now.
Excuse me. You guys are agitating her, like you can see that. So if you're gonna keep arguing, I'm gonna need you to step outside.
Well, I'm gonna stay here.
I'm leaving. I can't stand you anymore.
Due to multitudes of court hearings and appearances, Terry Schiavo's family is preoccupied. Meanwhile, she stays in a rehabilitation center. During this time, Michael Schiavo and the Schindlers battle the issues of having Terry's feeding tube removed. They visit as much as possible.
Hi, Mary. Are you okay?
Yeah. Look what they have done to my Terry. How is she?
She's doing okay. I was just giving her a bath.
Can I talk to you a little bit?
Yeah.
You know what? The court granted petition. They says her tube feeding can be removed now. I'm so sad. I don't want her to die like that.
Terry is still a dependent patient. The nurse still must use the partially compensatory nursing system to provide care for Terry. Here, we see the nurse helping Terry with hygiene needs. Terry is proclaimed in a persistent vegetative state with no chance for recovery as a functioning being. After many appeals, the judge rules that Terry's feeding tube can be removed again. Her feeding tube is removed and she spends her final weeks in Pinellas Park Hospice.
Terry, we're gonna be taking your feeding tube out today.
Terry reverts back to a patient who needs the wholly compensatory nursing system. Like any end-of-life care, the nurse can only implement measures of pain relief.
It's okay. You can go now.
Terry Schiavo never recovers from brain damage. After her death, an autopsy revealed permanent, irreversible brain damage, as evidenced by a brain size that is half the mass for a woman her age, height, and weight. Dorothy Orum's theory of self-care deficit was a likely theory to be applied to her case because she'd lost the basic life functioning. As the years progressed, her husband and family became increasingly preoccupied with legal battles regarding her terms for end of life. The nurse was a person who was always related to every hour and every care of the last 15 years of her life. The nurse was able to assess her level of functioning and whether Terry needed a wholly compensatory, partially compensatory, or supportive education nursing system. He or she was able to diagnose her problems and implement measures to rehabilitate or at the most care for Terry's living needs. Orum's theory is strong in that it provides a comprehensive base to nursing practice. It seems obvious that we as nurses care for those who cannot provide care for themselves. The 3 levels of nursing care are specified in her theory as well. However, limitations in her theory include having too much focus on the individual rather than the whole conceptual framework theory. It does not include the environment or family participation, something that Terry had an abundance of.
I'm gonna give you two some privacy.
My Terry.
You